please just leave. So, sir, what are some of the challenges you've had to encounter?
Yes, Bingham University Hospital is not immune to challenges all health institutions are facing in Nigeria. As a mission hospital, one of the fundamental challenges we are having is funding. You know, if you compare us with other teaching hospitals, for example, they get their funding from federal government, where they get allocations every day. But for us, as a hospital, we are being supported by the proprietor, which is EQUA. And you know, as a mission hospital, the funding is not enough. And so we depend mainly on what we generate, so that we can run the hospital effectively and provide quality health services to our population. So funding is one. Number two, because we are not a government hospital, a lot of people, we have problem with human resources. A lot of people come and they don't stay, because what is obtainable at the federal level is more compared to what we pay here. Even though what we pay here is comparable to some state governments, but when you talk of federal government, the federal mines, what we are paying is not enough. So one of the challenges is that people as we employ staff, they don't stay for long. Once they get a federal government opportunity, they leave. Another challenge we are having as an institution is that a lot of people see this place as the last hope, because it's a mission hospital. And even people that don't have funds for healthcare, they come here. Would they believe that because it's a mission hospital, we treat them, and we do. And so we go ahead and use our resources to treat these patients, and at the end, most of them cannot pay their bills. And so we have accumulated unpaid bills. And most of them, we allow them to go, and some of them will sign undertaking, but they will never come back. So we have accumulated unpaid bills. And these unpaid bills, we need the money to continue to run the hospital. Because as at present, the usual support from our foreign missionaries have dropped. And so they are not supporting it like before, and this is even worsened by the coming of COVID-19. And so we solely depend on the internally generated revenue. And the resources we have, because of COVID-19, the prices of hospital consumables and equipment have gone up in the market. And so we compete, we go to the same market to buy medical consumables just like federal teaching hospitals, and which of course they have the resources more than us. So because of some of these challenges we're having as a hospital, then we have these shortcomings, but we thank God that we are overcoming some of these challenges. But our fundamental challenge is funding, which is not adequate.
Yeah, as you said so much about the challenges that you've had to. So, Prof, the issue of medical tourism has been a very critical issue. What solutions are you providing to address this issue?
Yes, the medical tourism in Nigeria is at its peak because of the decay in the health system in Nigeria over the years. People have lost confidence, especially the elite, our leaders, the politicians, and probably because they can afford the care, so they can fly abroad. But the common man, the common Nigerian, don't have the resources to fly abroad. So as an institution, we are making effort to see that we provide quality healthcare to Nigerians, irrespective of affiliation. And also as a teaching hospital, we are contributing our quota. We have recently graduated the 9th set of medical doctors of Bingham University, and this is where they are trained. So we are making effort to see how we can contribute to the manpower development in Nigeria, where we train health workers, especially doctors. We are training nurses and pharmacists, and this is the workshop. This is where we train them as clinical, in clinical training. so that they can become skilled health workers, and they can now go to the society all over Nigeria and offer health services and reduce this decay in the health system. And we are also liaising with our missionaries abroad. Sometimes they help us with the resources, help us with the equipment, so that we can offer quality services to the Nigerians. But because our leaders, they don't have faith in the health sector in Nigeria, even though where they call it the store services are there, they still travel outside for treatment. And funny enough, most of these for the foreign countries they go and meet Nigerian doctors there to treat them. And so in our own way as a hospital, we are making, we are trying our best to provide quality services and also train health workers to help to reduce this medical tourism in Nigeria.
Yeah, thank you very much. In a couple of weeks from now, the world will be celebrating the World Health Day, the World Malaria Day. So in terms of the malaria scourge, do you think that the Bingham University vis-a-vis the Nigerian health sector will be able to address this scourge?
Well, I would say that the government, they made effort to control malaria through awareness, through provision of insecticide-treated nets, especially for pregnant women and under 5, children that are less than 5 years and below. But because of our environment, we will continue to live with malaria infection. And so, as an institution, what we do is to provide prompt healthcare services for people that come down with this infection, like malaria. And there are other infections that this hospital is known for. Like Lassa fever, for example. This hospital is known for Lassa fever. It will interest you to know that the first case of Lassa fever ever in the world was here in this hospital. When the first case in that time was like a mystery disease from a Lassa village in Borno State, where they brought the patient here. And we lost some of our missionary health workers that time to that disease, because as at that time they didn't know what the disease was. So they attend to these patients and they will get infected and die. And so it's one that survived was rushed to New York decades ago, and that's why the virus was isolated. And so since that time, this hospital is known for management of Lassa fever, which is of public health importance, just like malaria. And because of what we are doing, particularly in Plateau State, with respect to Lassa fever, the DG of NCDC, Nigeria Center for Disease Control, the former DG, Dr. Chikwe, that had just left office, he came and saw what we are doing and decided to build an infectious disease center for us. If you go out, you go and see it. It was built by NCDC because of what they saw we are doing as a hospital. Even though we are a mission hospital, ordinarily they want to go and build it in a government hospital. But because of what we are doing in Plateau State in particular, with respect to Lassa fever, they built a center. So we are doing our best to help in, contributing our quota in curtailing some of these public health issues in Nigeria, like malaria, Lassa fever, and so on.
Yes, thank you very much. Sir, do you think your institution has been able to achieve its vision and mission of an all-inclusive, qualitative healthcare services that is geared towards fulfilling the health mandate?
Yes, I can say we are fulfilling. When you have a vision, it's not something that you accomplish at once and say I have finished. So, but looking at our history, we have been providing qualitative health services to people, to all Nigerians. If you ask a lot of people in town, in Plateau State, they will tell you that Bingham University Hospital, former Ekwa Evangel Hospital, provide qualitative services. And also training, all inclusive, just as I said, all inclusive in the sense that we don't discriminate. And so we are providing training. We don't discriminate against whether you are a Muslim, you are a Christian, you are a traditionalist, or you are Igbo, you are Yoruba, whatever. We provide services to all people. And then in respect to training, we are training health workers, we are training doctors. We just graduated 9 sets of medical doctors of Bingham University because their clinical training is here in this hospital. And so we are providing quality training to health workers. And I know that our products, our graduates, our doctors are doing very well all over Nigeria. And we have testimonies from employers of labor. And in terms of research, we are doing a lot of research in this institution. And we will have a College of Medicine and Allied Sciences that is based in Jos here. The campus is just not too far from our office here, where we have the provost. And so we have various consultants in various fields of medicine that are conducting research, you know, in this institution, and that contribute to knowledge and progress of the Nigerian society. So I can say confidently that we are achieving our mission, but I know that we have room for improvement, and will continue to improve until we reach that peak that we want to reach.
Yeah, as in this era of unionism and the rest of it, you've seen the health sector suffered so much as a result of striking back, especially resident doctors. What's your institution doing to address this issue? Are you part of the idea that the medical personnel, resident doctors should go on strike?
Thank you very much. As one of our strengths is that we don't go on strike here. Since 1959 to date, we have never gone on strike.
Are you saying you are not part of your workers don't go into union?
No, we don't have unionism in this hospital. The doctors, we are members of Nigerian Medical Association. You know, it's not a union, it's an association of professionals. But association of resident doctors, our doctors are not part of the union. And our nurses are not part of the Nigeria Association of Nurses. You understand? They identify with those organizations, but because we're a mission hospital, we don't go on strike, because we don't believe in going on strike, because the first mandate of health workers is to save lives. Even though the government contributes to why health workers are going on strike, because they don't do what they're supposed to do to ensure that you have a safe working environment, you are well taken care of as a health worker, so that you continue with your work. But we do our best here for our staff. So there's no unionism in this place. We don't go on strike. Currently, I can tell you that there's a sister tertiary institution in Plateau State that they are currently on strike, but we are not. So we don't go on strike in this institution. We work 24 hours, 7 days a week, every year in this institution.
Yes, Plateau has suffered a lot of crises. Yes. We sometimes snowball into having victims as a result of this crisis. Yes. And most of the time, this hospital is being overstretched, promises from governments, yes, to pay the bills of these people. How far has this collaboration gone?
Yes, because of the strategic location of this hospital, most just crisis victims in the past, over the years, are rushed to this place. Because our sister teaching hospital in Plateau State is very far from here. And so because of the proximity of the hospital to the town, the victims are usually brought here. And usually the government will come in, and some non-governmental organizations will help us with consumables and some basic assistance for us to help these victims. And governments usually come here to say that we should go ahead and treat. And the government, I must confess that government of Plateau State, they are trying. They have settled some of the bills of these patients, but they can do more. The reason why I can say they can do more is because we still have some funds with the Plateau State government that they are here to pay us because of the treatment we offer to patients of crisis victims and to patients that had COVID-19. When COVID-19 came, that time that was very, very severe. We were treating patients on behalf of government. They paid part, but they are here. So it's one of the challenges we are having as a mission hospital. So the government, we are collaborating with government effectively. Even government are helping us to take care of these patients, but they can do more by providing us with more, resources. We are not even saying they should give us money. They can provide us with health workers, they can provide us with medical consumables and equipment, and even the patients that we have treated, they can pay the bills promptly to us, and that will help us to continue to offer the services.
Yeah, as we round up,
Yes.
the COVID-19 took the world by storm, and recently the World Health Organization came with an alarming information that Africa is relaxing. What is your take? Do we still have COVID-19 in Nigeria?
Yes, we still have COVID-19 in Nigeria.
But with the way people are going about the whole issue, it seems to tell that even recently Nigeria played a football match at the National Stadium, and we saw the influx of over 60,000. What is your take? What is your advice?
Well, the truth of the matter is that the health-seeking behavior of Nigerians is poor, and a disease of public health importance of this magnitude. Because there are a lot of misconceptions about COVID-19. I can assure you that in Plateau State there are 3 centers handling COVID-19: BUTH, Plateau Hospital, and this hospital, Bingham University Hospital. And I can show you our records of many deaths and many recovery from COVID-19. We somehow in the tropics were lucky that the disease is not as fatal as in foreign countries, for example, in Europe and America, for example. Why? We don't know. Probably because of the weather, the hot weather. But I can tell you that COVID-19 is real and is still there, even though with the vaccination of the populace, which I know the coverage is low, also helps. And there's what we call herd immunity. People are exposed to the disease, they develop antibodies to the disease. So once you have so many of those people in the society with those weapons in your body, they can fight against infection. But for those that don't have, they come down with the infection. But I can tell you that the infection rate, even our admission rate due to COVID-19 in the hospital has dropped. But that does not mean that the disease is there.
Yeah, still on that. Recently the Ghanaian government, other nations of the world, has given order that compulsory use of face masks should be dropped this time. And there are the school of thought that face mask is not good for the health. How do you juxtapose this with using face masks as a preventive measure?
Yeah, there are non-pharmacological, non-drugs measures to contain COVID-19, and use of face mask is one. Whether we like it or not, face mask is useful. It's just that our people are not used, they see it as a burden, because it's not easy to use face mask 24 hours. And so a lot of people, because of that, and especially those that have respiratory diseases, for example, they may not want to use it. And so face mask is useful. I know that because of the improvement in the interventions for COVID-19, there are countries that are now saying that the use of face mask is not compulsory. Like in UK, for example, they have relaxed most of the COVID-19 measures. So we cannot say that use of face mask is not beneficial in the control of COVID-19. The use of face mask is beneficial. You can see I'm here with my own. So especially when you are in a crowd, if you are alone, for example, you can remove it. But if you are with people, you understand, it's advisable you use the face mask so that you will not get exposed to the infection.
Yeah, finally, you have. I said earlier that this month the world is celebrating next month the world is celebrating the World Health Day. How will you assess the health sector in Nigeria in the last 62 years?
Well, the health sector in Nigeria when you compare it 62, 60, 62 years ago, 62 years ago, I can say there's some improvement, but the improvement is not what we expect at this stage. We're after 62 years, we expect that we should be more than this as a nation. And the reason is because government budgetary allocation to the health sector is poor. That is the truth. Let me tell you, in society where things are working properly, government support institutions like Bingham University Teaching Hospital. In fact, I remember during one of the administration in Plateau State, Solomon Lar, he was supporting Mission Hospital, because this Mission Hospital, they are non-for-profit organizations. We are not here to make profit, and we don't make profit anyway, but we provide services to people. Imagine government hospitals are on strike in Nigeria or in Plateau State, and we are also on strike. You can imagine the disaster. So unless government begin to change their perspective about Mission Hospital to assist them to do more for Nigerians, then we will continue like this. But because of the lip service government is paying to health, there is some, what we have achieved in the past is going down. You go to most hospitals, there may not be drugs, they write prescription for you, you have to go outside and buy. That's not how it's supposed to be. So after 62 years of healthcare in Nigeria, that's after independence, we expect that it should be more than this.
Yeah, just as a rider to that, your submission, is it responsible for the brain drain we have so far in the medical?
Definitely. It's contributory.
So,
because the government is not taking care of health workers. I can tell you that I have a lot of my colleagues that are now in Saudi Arabia.
So what has kept you in Nigeria so far?
What has kept me in Nigeria, because I have the passion. You know, if you are working in a mission hospital, if your first priority is money, you won't work here. I've been here for over a decade. That's one. Two, why this life, that's my own personal belief, it's not all about money. And you reach a certain stage in life that you have to make impact on your fellow human beings. And that's what is driving me. But that does not mean that I don't need resources to take care of my personal needs.
So what is your advice for those who are leaving Nigeria?
Well,
in droves.
Those that are, and people are leaving.
In droves.
And they will still leave. Because if I had interaction with my students recently in the class, and almost half of them are ready to, by the time they graduate, they want to leave Nigeria. The reason is because there is no even good enabling environment to work. Even in government hospitals, you want to work, but the equipments are not there. That's one. Two, the insecurity in Nigeria is also chasing people away. Three, when you compare yourself with your mates that are what they are paid outside, your own is a peanut. And so because of that, that is driving people outside this country. But we have to, some of us have to remain to move the health sector forward. Otherwise, because no matter where you go, home is home. You may come back one day, and if we are not here, then you come and see nothing. But we also need to know that those countries we are running to, their citizens built those institutions that we are running to. Some people paid to build those institutions. So we must remain behind to build our home.
Thank you very much, sir. Is there any last word you have for the good people of Plateau State, Nigerians, and those in diaspora?
Well, I want to, what I have to for the people of Nigeria and Plateau State in particular is that Bingham University Teaching Hospital exists to serve humanity. I know there are a lot of misconception outside that the hospital is expensive, but it is against the backdrop of people's perception and belief that because it's a mission hospital, it should be free, like in those days. But that support by our missionaries abroad have dropped for various reasons. So we go to the same market to buy medical equipment and consumables, just like government hospitals where they get subvention from government. So if we don't have these resources, we can't sustain the services. And I want the public to believe and to trust us as an institution that we are here for everybody. We don't discriminate. Wherever and whatever time they come to this hospital, 24 hours, we are there to serve them. And we promise to always offer qualitative services.
Yeah, thank you very much, sir. God bless you.
Thank you very much. Thank you so much for coming.